If you're over 60 and taking any diabetes medication right now, stop and watch this before your next dose. What I am about to share if you're over is something most endocrinologists never bring up during a regular appointment. Not because they do not care, but because nobody has time to explain what these drugs actually do inside a body that has crossed 60. Your metabolism is slower. Your kidneys filter differently. Your muscle mass is lower than it was 10 years ago. And the drugs that looked perfectly safe on paper when you were younger are now behaving differently inside you. I have seen patients take the right medication, follow every instruction, and still end up in the emergency room because of one side effect nobody warned them about. Today, I'm going to have that conversation with you. We are covering 5 diabetes drugs that millions of older adults take every day. Stay until the end, because the number 1 medication has been linked to a vision complication that most patients have never heard about. Let me ask you something honest. Have you ever felt more tired after starting a diabetes drug than you did before? Have you ever felt dizzy, foggy, or weak and your doctor told you it was just diabetes? Have you ever had a symptom that you quietly dismissed because you assumed it was just part of getting older? You are not imagining this. And it is not just aging. For millions of older adults, the side effects of diabetes medications are quietly creating health problems that often go unrecognized. And the most heartbreaking part is that most of these patients are doing everything right. They're taking their pills on time. They're checking their blood sugar. They're showing up to every single appointment. And still something feels wrong. This is not your fault. Nobody set you down and explained what these drugs actually do inside a body that is over 60. That is exactly what we are going to do today. No panique. No scare tactics. Just clear and honest information so that you can walk into your next doctor appointment knowing exactly what to ask. I want to be very clear about one thing before we go any further. This video is not telling you to stop your medication. Please never stop a prescription drug without talking to your doctor first. What this video is doing is giving you the information you deserve so you can have a real conversation with your doctor. Not just a 7-minute check-in where you nod and leave with a refill. There is one drug on this list that carries a risk most patients have never heard of. A risk that affects your eyes. We'll get to it very soon. Stay with me. Here is something most people do not realize. When you're 65, your body handles medication completely differently than it did at 45. Think of your kidneys like a water filter in your home. When the filter is new, it cleans everything quickly and efficiently. But after years of use, it slows down. The same amount of medication that passed through your body cleanly at 45 now lingers longer at 65. Your liver also processes drugs more slowly as you age. And here's the part that really matters. After 60, most people are already taking multiple medications for blood pressure, cholesterol, or other conditions. Each new drug has to share space in a system that is already working harder than it used to. On top of that, drug has muscle mass naturally decreases after 60. This matters more than most people think because muscle is where your body stores and uses a large portion of the glucose from your food. Less muscle means blood sugar is harder to control, and some diabetes drugs interact with this in ways that can become dangerous. This is the background you need. Now let's talk about 5 diabetes drugs that every adult over 60 should understand before their next appointment. Now let's talk about, I want to know where you're watching this from right now, and how long we get dealing with blood sugar and insulin resistance issues. If this is already making sense of something you've been worried about, subscribe to my channel and hit the notification bell so you never miss a video. If this content is helping you, type 1 in the comments or 0 if it does not. This content is number 5 with a class of drugs called SGLT2 inhibitors. The most common ones you may recognize are Jardiance and Farxiga. The most common ones by making your kidneys push excess sugar out through your urine. And for many patients, they work well. But here is what often goes unmentioned. Because these drugs make you urinate more frequently, dehydration becomes a very real risk. For someone over 60 who may already not be drinking enough water, this dehydration can put serious strain on your kidneys. The same kidneys that are already working slower with age. There's also a documented risk of genital yeast infections and urinary tract infections with these drugs. In older adults, Urinary tract infections can escalate quickly and sometimes reach the kidneys or enter the bloodstream if not caught early. But the most serious risk that almost nobody explains is called euglycemic diabetic ketoacidosis. This is a condition where your blood sugar looks completely normal on a meter, but your body is actually in a dangerous chemical crisis. Your cells are starving for energy and producing toxic acids. Because the blood sugar reading looks fine, patients and even some doctors can miss it entirely until it becomes an emergency. Research published in the BMJ has flagged this as a specific concern in older and lower weight patients. If you are on Jardiance or Farxiga and you feel sudden nausea, extreme fatigue, if you are on confusion or difficulty breathing, please go to an emergency room right away. Do not wait for your blood sugar to look high, because with this condition, it may not. Number 4 is metformin. I want to be careful here because metformin is one of the most studied and generally well-tolerated diabetes drugs in the world. For most people, it is a safe and effective first choice. But there is a specific issue with long-term high-dose use that is extremely well documented and almost never discussed with patients. Studies consistently show that between 10 and 30% of people who take metformin long-term develop a significant deficiency in vitamin B12. This is not a small or rare thing. This is potentially 1 in 3 long-term metformin users. Metformin interferes with how your gut absorbs B12, and B12 is essential for your nerve health. Metformin is the problem. When your nerves start suffering from B12 deficiency, the symptoms look almost identical to diabetic neuropathy. Tingling in the feet, numbness, weakness. So what happens? The patient mentions these symptoms. The doctor says it is diabetes affecting your nerves. Nobody checks the B12 level. The metformin continues. The deficiency gets worse. This connection has been confirmed in multiple studies and is acknowledged in medical literature, including publications from the American Diabetes Association. If your connection has been metformin for more than a year and you have any numbness or tingling, please ask your doctor to check your B12 level at your next visit. A simple blood test. A simple fix. Number 3 is a class of older drugs called sulfonylureas. If you're taking glipizide or glyburide, this section is especially important for you. These drugs work by pushing your pancreas to produce more insulin regardless of what your blood sugar is actually doing at that moment. In a younger patient with reliable kidney function and stable eating patterns, this can work. In a younger patient, but for someone over 60, this mechanism becomes risky. Here's why. But if you skip a meal, eat a little less than usual, or do more physical activity than normal, these drugs keep telling your pancreas to pump out insulin even when your blood sugar is already dropping. This causes hypoglycemia, which means your blood sugar falls too low. In a young person, low blood sugar causes bad, but manageable. In an older adult, it can cause sudden dizziness, confusion, and falls. Falls are not minor events for people over 60. Research from the Journal of the American Geriatric Society has linked sulfonylurea-induced hypoglycemia to increased rates of fractures and hospitalizations in older adults. A hip fracture in a 68-year-old can begin a chain of events that completely changes their quality of life. This is not a theoretical risk. The 2025 American Diabetes Association Standards of Care for Older Adults now explicitly recommend that doctors consider stopping sulfonylureas in many senior patients and moving them to safer alternatives. If you're on glipizide or glyburide, you deserve to know this recommendation exists. Ask your doctor directly if it applies to you. Number 2 is tirzepatide. You may know by the brand names Mounjaro or Zepbound. This drug has become extremely popular because of how effectively it lowers blood sugar and promotes weight loss. And for certain patients, it is genuinely impressive. But there is a serious conversation that is not happening enough around seniors specifically. When these drugs reduce appetite significantly, as they're designed to do, patients eat much less. Less food means fewer calories. Fewer calories means the body looks for energy elsewhere. And in older calories, one of the first places the body pulls that energy from is muscle. This process is called sarcopenia, and it is already one of the biggest health threats facing people over 60. Muscle loss after 60 is directly linked to falls, fractures, weakness, insulin resistance, and a shorter lifespan. Research published in journals covering obesity medicine and geriatric health has raised concerns that aggressive appetite suppression in older adults, without a structured resistance exercise program and adequate daily protein intake, can accelerate muscle loss and cause serious long-term harm. The drug companies are not hiding this, but nobody is putting it in plain language for patients. If you're over 60 and on tirzepatide, you need to be having an active conversation with your doctor about protecting your muscle mass through protein intake and some form of resistance exercise. This is not optional. This is critical. If this video gave you something you did not have before, hit the like button. It takes 1 second, and it helps this video reach other people over 60 who are sitting at home with the same unanswered questions you had before you press play. One tap from you could genuinely put this information in front of someone who needs it today. And now we have reach number 1. This is the one I told you about. We have reach, the one involving your eyes. Semaglutide. You know it as Ozempic or Wegovy. Right now, this is the most talked about diabetes and weight loss drug in the world. Right now, 1 in 8 Americans are currently taking a GLP-1 drug, and semaglutide is leading that wave. Most of what people hear about the side effects is nausea, vomiting, and stomach discomfort. Those are real. But there's something else that is not getting nearly enough attention. In 2025, a study published in JAMA Ophthalmology found that patients using semaglutide had approximately twice the risk of developing a condition called NAION, which stands for non-arteritic anterior ischemic optic neuropathy. I know that is a long phrase, so let me explain it simply. NAION is a form of sudden vision loss in one eye. It happens when blood flow to the optic nerve gets disrupted. It can cause permanent vision loss, and it can happen without any warning at all. The researchers analyzed data from thousands of patients and found this association specifically with semaglutide in absolute numbers. But for a 65-year-old who may already have some changes in blood pressure, circulation, or eye health, this is a risk that absolutely deserves a direct conversation with your doctor. Additionally, semaglutide carries documented risks of pancreatitis, which is a painful and potentially dangerous inflammation of the pancreas, and gallbladder problems, including gallstones. Both of these risks are mentioned in prescribing information, but are rarely explained clearly to patients before they start the drug. If you're on Ozempic or Wegovy, I'm not telling you to stop. I'm telling you to ask your doctor about your eye health, your gallbladder, and your pancreas at your very next appointment. You deserve that conversation. I want to pause here and say something directly to you. If any of what you just heard made you feel scared or overwhelmed, I completely understand that. But here is what I want you to hold on to. Your body is not failing you. Your medication is not your enemy. The problem is not the drug itself. The problem is the missing conversation. The conversation where a doctor sits with you long enough to explain that your body at 62 is not the same as a body at 42. That the same pill behaves differently inside a different body. That you deserve to know exactly what you are taking and why. Understanding this does not mean you need to be afraid of your medication. It means you are now equipped with real knowledge to protect yourself and to advocate for your own health. And that is a completely different and much better feeling than sitting in the dark. So here's what you do next. At your very next doctor appointment, bring these questions with you. Write them down if you need to. If you're on Ozempic or Wegovy, ask this. Has my eye health been evaluated since I started semaglutide? And am I at higher risk for optic nerve problems? If you're on Mounjaro or Zepbound, ask this. What is our specific plan to protect my muscle mass while I am on this medication? If you're on glipizide or glyburide, ask this. Given the 2025 ADA guidelines for older adults, is a sulfonylurea still the safest choice for me right now? If you're on metformin long-term, ask this. Has my B12 level been tested recently, and can we please add that to my next blood panel? If you're on Jardiance or Farxiga, ask this. What are the warning signs of euglycemic DKA, and at what point should I go directly to the emergency room? These are not confrontational questions. They are the questions of an informed and engaged patient. Any good doctor will welcome every single one of them. Here is something nobody talks about. The healthcare system is not designed for long conversations. Your doctor has an average of 7 minutes with you. 7 minutes to review your chart, check your numbers, answer your questions, and send you out with a plan. In 7 minutes, nobody is explaining how semaglutide interacts with your optic nerve or why your B12 has been quietly disappearing for years. That is not negligence. That is just the reality of how medicine works today, which means the patient who walks in with nothing gets 7 minutes of routine. But the patient who walks in with one specific informed question gets a completely different appointment. They get a doctor who stops, thinks, and actually responds. That gap between those two patients is not knowledge. It is not access. It is not money. It is simply preparation. You just got prepared. That is worth more than you realize, and it costs you nothing but the time you spent watching this video today. Before you go, please share this video to someone you love. Send it to a family member who is managing diabetes. Forward it to a friend who just started a new diabetes drug and has no idea what to watch for. Show it to your spouse, your sibling, your neighbor. You already have this information, and someone in your life needs it today. Now, before you leave, there is something important. Every single morning, millions of diabetes patients wake up with high fasting blood sugar before they have eaten anything, before they have taken a single pill. They blame themselves. They blame their diet. But the real answer is something most doctors never mention in an appointment. I made a dedicated video on exactly this problem. It covers one specific morning habit that has real clinical research behind it, and the results people are seeing inside the first week are genuinely shocking. This could be the missing piece you have been looking for. It is on your screen right now.